Hello, good afternoon, everyone. I am Dr. Seyi, and I am the founder of Dr. Seyi Absolute Wellness, as you all know. So, and we practice integrative medicine and functional medicine. And this is a blend of conventional medicine and alternative medicine. So we help you locate the root cause of any medical condition. And so today, I would like us to introduce ourselves, where we're calling from. Okay, so I would like us to introduce ourselves and where we are, where we're listening to this live videos from. Okay, so yes, we'll be talking about fertility. As you all know, I love women's health, so we'll be talking about fertility. And at our topic for today will be on improving fertility, the causes and some of its management. So when we talk about infertility, most times we see couple come to us and say that maybe just 2 months into their marriage, they are already getting scared and they are weary, they want to get pregnant. But in the real sense, when you want to say somebody there's a case of infertility, you have to, both of you must have had sex consistently for at least a year before you can now say that, oh, there is a problem. But yes, I understand her fears, I understand her worries, that okay, maybe after a few months and there is nothing, we'll get what. So it's actually good to start seeking for help, to know that, okay, to know that if there's any issue, so that you can actually optimize it. So that's why sometimes when we see some clients, they tell us their history, they give us their history, they tell us everything that is wrong, then we tell them that, okay, let us just wait for some times, let's see what happens. And what we can just do why we place them on hold is to just give them some things to maybe just to use, some few things, maybe for some few vitamins to use, and good prenatal vitamins to use, and then maybe omega-3, so that just to optimize while the wait. So now, infertility. So what are the causes of infertility? The common, we're going to talk about some of the common causes of infertility that we all know and we may not know. Okay, we have scarring from surgery. Pelvic surgery can damage and scar the fallopian tubes. Maybe you've had a previous surgery, and during this surgery, a lot of things could have happened, a lot of things could have gone wrong, and you have some form of additions. Additions is when you have two flesh, they are stuck together. When you have them stuck together, so that could cause a scar, that could cause an addition, which should lead to a scar. Do you understand? So when you have this scar, take for example, okay, I think the next live video we're going to do, I'm going to be showing you a diagram of the female reproductive system, so that you would understand what I'm trying to explain. But it starts from the ovary to the tubes to the womb, which we call the uterus. So take for example, there is a little problem around the fallopian tubes. The fallopian tubes are scarred. Both are scarred, like they are stuck together, and you have a ripe egg. This woman does not even have any issues with the eggs. You have a ripe egg, and this egg falls from that place into the tubes. But because there is a blockage in the tubes, it could be a partial blockage, it could be a full blockage. But because we have blockages in the tube, then this egg or these eggs will not would not proceed. Do you understand? Would not move further. So there's a problem. So meaning um the sperm cells would not even meet the egg to fertilize the egg. Do you understand? So that is one of the reasons why scarring from surgery, or especially previous pelvic surgery, could lead to infertility, because there is no. So now take for example a situation whereby it's a partial blockage. This egg can even find its way, or the sperm cells can find its way, swimming to meet this egg. Fertilization occurs, the whole process of fertilization start happening, but because this baby cannot because this egg that has been this fertilized egg cannot move past that obstruction, that additions, then it gets stuck in the tube. And when it gets stuck in the tube, it starts growing there, and that is where you will find a case of ectopic pregnancy. And a woman tells you that, oh, I have ectopic pregnancy, or they just or they present with some, they present with symptoms such as, maybe the woman fainted, or a lot of things happen, bleeding, and the next thing you do is scan, and they find out that the fertilized egg is growing in the tube. So that is also another so that is one of the complications of an obstruction that I'm trying to say. Now, this is one of the ectopic pregnancy is one of the complication of an obstruction of the tube. So now, another cause of infertility that most women experience is polycystic ovarian syndrome, ovarian cyst, and primary ovarian failure. But when it comes to a situation of cyst, polycystic ovarian cyst, and ovarian cyst, they are actually subfertility states. Because some women with cyst or ovarian cyst, have been able to get pregnant, while some have not been able to get pregnant. Do you understand? So that is the case. Then we also have, but most times, most women, experience infertility as a result of PCOS and ovarian cyst. So we have thyroid diseases too. When you have issues with the thyroid, you have the hypothyroidism, you have hyperthyroidism. There's every likelihood that your hormones will be deranged, especially with the case of hypothyroidism. There's a way a whole lot of things goes wrong, from the adrenal gland, which is in charge of your cortisol. Maybe you are too stressed, and that's why we tell women trying to conceive that you have to reduce your stress level, ensure you engage in stress relief activities, ensure you are able to manage your stress. Do you understand? Because these are things that can actually lead to infertility. These are things that can actually make your hormones go deranged. And once one of the problem with hormones, when we talk about fertility hormones for both men and women, is this: once one is deranged, there's every likelihood that that same one that is deranged pulls out one, 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 pulls out one. Do you understand? So as it keeps pulling everything, then everything keeps coming down. Do you understand? And it causes a lot of problems. You start having different weird signs and symptoms. Then another cause is hormonal imbalance that I just talked about. A lot of your FSH. I'm sure some women have done a lot of tests that would show that FSH, LH, a lot of hormones, prolactin, progesterone, testosterone, a lot of hormones go deranged. They go deranged, and you are not able to you're not able to conceive. So then we also have, when we have cervical mucus problem, the cervix is where on the next slide I will be showing you a structure of the female reproductive system, as I've said. So then you'll be seeing what the cervix looks like. The cervix is actually the mouth. In layman's language, let me say, is the mouth of is the mouth of the womb that carries your baby. So like, like you have the womb like this, and you have a structure like this, and the cervix, so that particular side is where that's the cervix. So, and this, it's a, it has its own mucosa surface. It has its own surface that produces, that secretes some things, that secretes some fluid that helps enable sperm cells to move upward. So when you have issues with cervical mucus, you're not producing enough or good mucus, then there's every likelihood that the sperm cells, when the man ejaculates, release the sperm cells into the vagina, there's every likelihood that these sperm cells will not be able to move upward, because for these sperm cells to even move to go and fertilize the egg, they need a favorable environment. Do you understand? So if they are not able to get this environment, then fertilization will not even occur. Like the sperm cells will not even get there. So you can see that there are a lot of issues that women and men go through to bring a life. So infection, I'm sure you all know this. Infection is another big one. In fact, this is big. This is big too, because a lot of people, I will tell you that a lot of people suffering from infertility are actually, it could actually be as a reason of infection. Do you understand? And they don't know. And that is why I'm still going to talk about antibiotics. As good as antibiotics are, they are not enough to to tackle these infections. Always there are times that you have to go extra miles to get to tackle these infections. So take for example, I think we made a post, was it last week or about 2 weeks ago, about chlamydia. Chlamydia looks like as if, oh, it's just a tiny thing walking all around. It's a tiny bacteria walking around, but it's very terrible. It's very, very terrible. Like when a woman have it and you don't know, you can actually, you would it can actually over time, over the years, it can actually over the years or over the months, it can tamper with a lot of things in the female reproductive organ, same as the male reproductive organ. So when you have a case of chlamydia, you want to ensure, but most times most people don't even know that they have, they are suffering from all these things. So gonorrhea, they don't know. So it's good that you get yourself, you cleanse yourself, you ensure that there is no infection. If there's any sign or any symptoms of infection, you want to clear that out, so that that at least infection is not the problem. That's not the reason why you have not been able to conceive. Then we have fibroids. Really, though fibroid is not, should not really stop you from getting pregnant, but it can also stop you from getting pregnant, depending on the location and a lot of things that are involved, the sizes. We've seen a lot of women that have fibroids and, are pregnant today. So fibroid is just like, when I talk about PCOS too, there are subfertility states in conditions whereby you can still get pregnant. They should really not stop you from getting pregnant, but they actually stop some women because, number one, the location of the fibroid. Just imagine if there is this big tumor hanging around the cervix. Do you understand? And the sperm cells cannot even move in. That is one. Then imagine if this tumor is hanging somewhere inside the womb. So if it's hanging inside the womb, and okay, let's assume fertilization even takes place, the baby comes into the womb, fertilized, as in gets attached to the womb and start growing. As the baby start growing, if this tumor is too big, the tumor would compete. And the unfortunate thing about fibroid is that fibroid competes with the baby. That is so bad. It competes with the baby. So when you have a situation whereby you have the baby growing and the fibroid is there, that could also lead to an early miscarriage too. So those are the ways you can say that fibroid is an issue. Then we have endometriosis. Yeah, a lot of women suffer from endometriosis. Endometriosis. Let me just explain endometriosis. Endometriosis is like, normally, there is a lining. There's something that lines the womb. There's something in the womb. So this thing in the womb, these are the things that get stimulated by those hormones to, take for example, to produce your menstruation, to enable your fertilized eggs to attach to the womb and start growing. So in a situation whereby this thing that I said are inside the womb, that lines the womb, they now grow somewhere else. Do you understand? Outside of the womb. So meaning, if the woman is menstruating, at that same time, those parts that these things are growing to would also be menstruating. They will be weeping. As it's so bad. They will also weep. They will also menstruate. Like blood will also come out of them. Do you understand? So, and there are cases, there are severe cases whereby some people even have this in their lungs. So you can imagine, and they experience terrible pain, severe pain. So imagine you are menstruating, you're having severe pain down there, you're having severe pain around your lungs, or maybe if this tissue is growing in your abdomen, in your stomach, or maybe in your anus. Some people even grows around their anus. So imagine if all these things are happening at the same time you are menstruating, all those sides are bleeding. So you can see that that's a serious turn off for the woman, because she is in serious pain every menstruation too. At that point, they experience every menstruation too. So this is this is also another leading cause of infertility. A lot of women experience this, and because of this, they have not been able to conceive. So we talked about okay, we also have pelvic inflammatory disease. But pelvic inflammatory disease is also classified under infection. But I'm saying, I mentioned this again to just clarify that, okay, when we have because some people will ask, okay, what's the difference between PID, STDs, and STIs? One of these days we'll also discuss about that. Like, we'll talk about PID, pelvic inflammatory disease, sexually transmitted disease, and sexually transmitted diseases. STI and STD are the same thing. Do you understand? So, but when we talk about PID, PID is a subset of STD. Like, it's pelvic inflammation, meaning your pelvic region is inflamed, and it could be inflamed as a result of bacteria that have come in, maybe through sex or something, and through sex here, and you get infected. And when it comes to this infection in women, especially in women, it's so terrible, and we call them ascending infection. And why do we call them ascending infection? This is because, take for example, during sex, it goes in like this. So if it goes in like this, any bacteria that came in at that point, they also want to move up. So that is why you find out that some people, when they go to the hospital, when they run their HSG, that is the test that you use to check if your tube is patent, like it's working well, like it's true. These are, the doctors tell them that, oh, you have a blockage in the tube. You have an infection in the womb. You have an infection around your cervix, because these terrible bacteria are causing serious problems in that area, and this will lead to infertility. This will definitely lead to infertility. So we have sterilization. We all know that. Take for example, when they say that sterilization is like this. Okay, take for example, maybe you've had all your kids and you now want to go for surgery. Maybe the last one you're going for, or you told them that, okay, I want a tubal ligation. A tubal ligation is like cutting the tubes. Do you understand? Tying you are cutting and tying the tubes. So once it's tied, there's no any eggs that comes there, just gets spoiled there. Let me use that word, and that is the sperm cells cannot come in to fertilize the eggs. So sterilization. So men too also do sterilization too, that okay, I don't want to produce sperm cells anymore. Do you understand? So those are causes of infertility. But you know, those are really not, those are not sterilization is not a deliberate cause of infertility. So I'm going to put this, you know, at the back, because you know you would not go to the hospital and say that okay, I want this course when you know that you are still like 21 or 25. I want you to tie my tubes. You know, you will not do that. So then we have, you know, some form of medications, we have some drugs, and I'm sure you know some of the drugs, you know, some of the contraceptives. You know, contraceptives are, a lot of women are on contraceptives, and you know, so if you're on contraceptives, you don't expect to get pregnant. And I'm sure one of these days we'll also talk about contraceptives and how these contraceptives are, some of them are causing damage to you. Do you understand how they are causing damage? Okay, so now let's pick hormone imbalance. So what are the causes, some of the causes of hormone imbalance? Okay, we have your lifestyle, you know, your habits, food you eat, things you indulge in. You know, these are things that could cause your hormones to go deranged. You know, when we talk about, that's why we keep telling and advising ourselves that, you know, let us stop junks. You know, junks are how to, too much sugar is out of it. You should not be found taking too much sugar. You know, you're taking too much of fizzy drinks, a lot of things. You know, these things have additives in them, and these additives or the sugar content, you know, would make them go, can make the hormones go gaga. You know, they make the hormone go deranged, and when they go deranged, it becomes a problem. You know, infertility can actually set in. You know, then your environmental condition, you know, in this case, this is where we advise that, you know, use of insecticide, pesticides, that we should, you know, minimize their use, or make sure that we don't live around that environment, because the chemicals these things produce can actually compete with the keys. You know, they can compete with the cells that are supposed to make your hormones function properly. They can mimic these hormones and make your hormones go gaga, make it go deranged. So you want to ensure that, you know, you are very sure of your, what you use in your environment. Do you understand? The endocrine gland malfunction. Take for example the adrenal gland I was trying to talk about the other time. You know, if anything goes wrong with the adrenals, you know, the cortisol decides to go up. The cortisol, there is a way, there's a pathway that, you know, this thing also causes some derangement too in the hormones. When the cortisol goes up, it makes the, you know, it steals the progesterone. The progesterone goes down. It can make the thyroid to go down. You know, make some of the, maybe some of the female hormone, the female stimulating hormone, go down. So when you start having this, then infertility can also set in. Then some medications too can also cause that, such as the contraceptives. Then we have stress. Like I've said this earlier, stress is a major cause of infertility. Stress, because stress battles and deals with your hormones. It knows, stress understands that pathway, it knows how to deal with your hormones. And once that sets in, you know, that could also lead to infertility. Then we have maybe injury or trauma. Do you understand? Like we talked about earlier, a situation whereby you've had a surgery in the past, you know, that could cause a problem too. And that could lead to infertility. So how do you manage you know, some managements? Okay, take for example, you want to manage hormone imbalance. You know, we get a lot of questions. You know, it's actually a broad game. It's actually a broad one. It's broad. Like when I say it's broad, it's broad. And this is why we usually advise clients that, I'm sorry. This is why we usually advise clients that you should, you know, book a proper appointment. You know, when you book for a proper consultation, This will help us go into details, like find out what exactly the problem is. Do you understand? So when we're able to figure out what exactly the problem is, then we're able to profile the right solution to what the problem is. So when it comes to hormone imbalance, it's a big deal. It's a big game because a lot of things are involved. Do you understand? But we're going to give you some few points that, baseline points, foundational points that you can work with while you book to see your doctor. So, exercises are key. We say that, oh, exercises, regular exercises are key. But see, when I talk about exercise, I'm not saying, because when you're trying to conceive, you also don't want to engage yourself in rigorous exercise, exercises that will be too rigorous, because you don't want to cause further stress on your gland. You don't want to further stress your body, because you're trying to conceive. So you want to engage in exercise. So exercises such as, walking around, a brisk walk that will make you sweat. Sweat is fine. Swimming, if you can swim, is fine. Jogging, if you can jog, is fine. Dance, if you can dance, is fine. Yoga is also a perfect one. Do you understand? Especially if you can dance, while we dance, you can turn on your music, get a music on YouTube, turn it on, because not everybody have that strength to walk around, and that motivation. Though we usually advise that you are motivated to do this, because if you are not motivated, even to turn on your YouTube to dance will be a problem. So the first thing is, when it comes to any issue, any health issue, such as hormonal imbalance, is to even be aware. You have to be aware that, oh, I have this. Accept this. Yes, we're not saying you should not pray about it, and don't forbid it. Do you understand? Because God forbid, this is not me. I'm not saying that you should pray about it and take actions, take steps. And one of the first things when it comes to healing is, self-awareness. Once you are aware that you are sick, something is not right, then you are able to, you would want to go further to see the next person. Okay, who can help me with this in this situation? But once you are not even aware, and you are not doing, God forbid, it keeps getting worse, and a lot of problems setting. So we're talking about exercise, that's just moderate exercises, mild to moderate exercise. If you're trying to conceive, mild to moderate exercises are good for you. Except maybe it's a case of, take for example, maybe a client with PCOS with excessive weight. Yes, you can go to do your high strength, high strength intensity exercises, because we know that the first thing you want to do is even, drop that excess weight. But you're already slim, you're already moderately, you're not obese, or you're not, do you understand? So you should not engage in too much exercises. Just those ones I mentioned are good. Then we also have, yes, maintaining a moderate weight. So maintaining a moderate weight is key for fertility. That's why you find some cases that even you want to do IVF, IVF. I'm sure for those that have tried IVF and are on the big side, I'm sure your doctor have told you that, see, madam, you have to lose weight. That's the first thing. You have to lose weight. If you don't lose weight, we cannot, we may not be able to proceed with this projects. So you have to lose weight. So moderate weight is actually key when it comes to balancing your hormones. Then your gut health is key. Gut health is key. When we talk about anything, we ensure that, we always say that, in fact, the father of medicine said that all diseases begin from the gut. So, and in medicines, we also believe that, especially in the alternative parts of medicine, we also believe that, when you're able to take care of your gut health issues, you have solved a good number of, you've solved about 70% of your problems. Do you understand? So gut health is key. So if you're trying to conceive and you've not been able to optimize gut health, you have to optimize gut health. Gut health is key. And gut health now comes from, there are a lot of signs that may be associated with, that also helps the gut heal itself. Do you understand what you fill the gut with? So we also have, when you're trying to conceive, you don't want to go into too much of fasting. You don't want to go into too much of fasting. You don't want to deprive your body of some vital nutrients. You want to ensure that you are taking adequate protein, adequate fiber, healthy fats. You want to avoid alcohol, caffeine, sugar. You want to reduce your carbohydrate intake. So when you're trying to conceive, you have to ensure that you have good amounts of protein on your table. You have a good amount of fibers, which can come from your vegetables, fruits on your table, and you want to ensure you also have healthy fats on your table. And I'm going to talk. This will make me talk about some of the fats that we use. Take for example our cooking oil, the vegetable oil we use. That is not what we should use for cooking. You have to use healthy fats such as avocado oils, coconut oil, almond oil. I think these are the common ones, and sesame oil that you can get around us. So using these oils will help you. So another form of healthy fat is avocado. Take for example, in the morning, you're trying to make a smoothie. You can add, now I've talked about, having healthy protein, healthy say for example you want to have a smoothie in the morning. You can have a combination. You can have a list of protein. It could be a protein powder. Like now I have a smoothie here. Now in this here I have my protein powder. I have a little mango puree in it. I have avocado in it. I have a little Greek yogurt in it with water blended all together. So this will also help you. So even for anybody, that's the way you should actually eat. Once I don't know if you've noticed this, when you take too much carbohydrate, for example, just try it. Take too much carbohydrates in the morning and see what happens. By 12:01, you're already scattered everywhere. You are terribly hungry. You want another food. You want to eat. And if you've tried healthy living before, the way someone that eats healthy and someone that takes chunks, the way they get hungry is different. That of those people that are on junks, their hunger is not on this level. Like, it's so terrible. It's terrible. They get so hungry as if there is no tomorrow. While those that are that eat healthy, do you understand? It's just a mild form of hunger. Mild form of hunger. You are not too pressed, but you know that you have to get something to eat because you want to nourish yourselves with vitamins. And we get a lot of vitamins from our food, but most people don't know that a lot of vitamins from our food. Then engage in stress reduction techniques. And again, okay, this I want to talk about something. When you're trying to conceive, there's a place for patience. You have to be patient with whoever is with the doctor trying to manage you, treat you. Because when it comes to a case of fertility, we all differ, we all present with different things, and you have to understand that, okay, it's a phase. You don't expect to start your fertility program this month. You are consistent with it this month. You are consistent with it next month, and the third month, you can't be found anywhere. Nobody can find you. They keep calling you, chasing you with calls, or you are not still on that regimen. Fertility is a journey. Is a journey. You have to keep working it. Keep doing the right thing before you conceive. You can't just say that in 2 months you want to optimize fertility because you did not, your hormones didn't get trimmed in 2 months or 3 months. It's a constellation of things. Like, these are things that's been happening for years. In fact, maybe since when you're as a teenager. And that's why we try to talk to our parents, to our mothers, that let's ensure we give our children the right food, because a lot of things are happening as to our teenagers too. Do you understand? So I'm sure we'll also we'll also talk about this in one of our lives. So maybe we'll just talk about teenagers, and how they should be fed, or things that should be taken out of their food. And that's why you see some kids this day. You see a girl of 15 years old, and you see her, she looks like a mother. You see, in fact, when you see myself and some 15-year-old girls, you feel that they are way older than myself. And I'm sure you've seen a lot of that. So it keeps happening. And, these things, as it's happening, is also ruining their hormones too. So we want to ensure that we give them the right food and the right things to do, so that they don't bother us with issues in the future. So you have to sleep. Sleep is very key when it comes to fertility or any health issue you're trying to solve. Sleep is key. Please, you have to learn to manage your stress. You have to sleep. If you're trying to okay, I've seen situation whereby I've seen clients that yeah, you are busy with business, you're busy with your business, you're busy doing a lot of things, and you are not able to sleep. Please, you have to learn to sleep. It's a different thing when you cannot even sleep at all. Yes, I know some clients are battling with that. They cannot even sleep at all, and it's not their fault because the hormones have gone deranged. Yeah, this is what I've experienced. I know it. So when I'm talking, I know what I'm saying. Like the hormones have gone deranged, so they cannot even sleep. So do you understand? So you have to help them to sleep. But in a situation whereby you sleep is there, you want to sleep, and you're not giving the body that sleep, it becomes a problem. Do you understand? So as you are treating yourself, taking your herbs, taking your supplements, doing your therapies that are prescribed to you, you also need to ensure that you incorporate sleep into your programs. Do you understand? And you have to see a doctor. See a doctor. Seeing a doctor is key. Seeing a doctor will help you, and that will help you find a solution, a lasting solution to the problem, and will help you draw a plan. Take, for example, at Dr. Seyi Absolute Wellness, what we do is we draw a detailed plan for our clients for them to follow. We do follow-ups with our clients too to ensure they are doing the right things. And the good thing about a detailed program is that week 1, week 2, week 3, I feel that, or you're telling me that, oh, I feel this way. I feel I'm getting better on this side, but I feel that this side there's something wrong. I've been feeling this way. We are able to review, and that's what makes us different. We're able to review with the clients and tell the client that, okay, this is what we'll be doing now. Okay, let's stop this. Let us add this. Do you understand? Or we can say, okay, just continue with it. You're on the right path. Things will fall in place. Do you understand? So those are things that we do. So then let's just talk a little about fibroids. If you have fibroids, in the hospitals, doctors give some medications that can help you shrink them a little. Then after that, they prescribe a surgery to you, and you do. So if your fibroids are actually very, very big, yes, you just do a surgery. Then, but the thing that's what we keep preaching to clients is that once you have done a surgery, after you have healed and you are fine, please go for a program like that would help you balance your hormones, because if you are not careful, these tumors will grow back again. Like they will grow back again. It has happened. I've seen several clients, like in 2 years after doing a surgery, they come back again with same tumors in the womb or growing anywhere in the pelvic region. So that's why we advise our. Thank you. So someone have a question here that says, please doctor, what is the main cause of infertility? She said, what is the main causes of infertility? Really, you can't say there is a main cause for infertility, but there are things that are common. Take, for example, infection, like I said earlier, pelvic inflammatory disease. A lot of women don't even know that they suffer from, a lot of women don't even know that they suffer from this infection. And a lot of them don't even know that it's because of this infection that they have not been able to get pregnant. And that is why you see that when some women use our products, the cup effect, after they use it, that is those with pelvic inflammatory issues, they get pregnant immediately. Like it's spontaneous. They get pregnant immediately. While we have some that they don't even have issue with pelvic inflammatory disease, it's just their hormones and they use it to still get pregnant too. So you can't really say the main causes, but we have highlighted some causes when we started this life, and some of those causes are, we have the polycystic ovarian syndrome, thyroid diseases, fibroid, hormonal imbalance. If you go back, I'm sure we'll be posting this video. If you go back, you would see, because I explained each of them and why they can cause infertility.